Some medical conditions are easy to recognize. The symptoms are apparent and physicians have set protocols to get to the diagnosis and provide treatment. This scenario is far from the reality when it comes to diagnosing perimenopause. The symptoms of perimenopause can be more vague and are often the same as symptoms of other conditions. As a result, women face many challenges when it comes to getting a diagnosis and the treatment they need to help navigate and control their perimenopausal symptoms. Today, we speak with Dr. Salyan Ismail to better understand this natural transition that occurs in every woman's life, why it occurs, how it may present, the impact on our lives, and what are the options available to help us live healthier, vibrant, and more fulfilling lives. Planning a family or just want to keep your cells healthy? Vitamin B9 or folate is crucial for cell growth, red blood cell production, and fetal development. Cell and DNA growth, essential for making new cells and repairing DNA. Supports pregnancy, prevents birth defects, and supports healthy brain development in babies. Prevents anemia. Folate helps your body produce red blood cells to prevent fatigue. Where can you find vitamin B9? Leafy greens, spinach, kale, and asparagus. Beans and lentils, great for plant-based diets. Oranges and avocados, delicious sources of folate. Fortified cereals, an easy breakfast option. Low folate levels can lead to fatigue, poor cell growth, and complications in pregnancy. For healthy cells and a strong body, make vitamin B9 a part of your daily diet.
Radiographer at the radiology departments at the community hospital. We offer high-quality service with state-of-the-art equipment in X-ray, ultrasound, CT, and mammogram. Come, our friendly staff awaits you.
Give us a call at 235-5479.
The Community Hospital of Seventh-day Adventist,
where good private health care is affordable.
Before you take your omega-3 supplement, check for the natural product number NPN on the label. This unique code shows that Jameson products have approved rigorous Health Canada testing for safety and effectiveness. Unlike some supplements that carry disclaimers like not approved by the FDA, Jameson Omega-3 is the trusted choice, offering 1800 milligrams of EPA and DHA for heart health. Choose quality. Choose Jameson.
Okay, so today I think everybody is very familiar with the term menopause, and my intention today, bringing you on set, was to demystify as well as dissect exactly what is menopause, what causes it. So first of all, let's get a definition, a working definition of menopause.
Okay, easy. Women our age, in that middle age category, all have to transition through the end of your reproductive age. That is what menopause is, essentially. When your ovaries start to fail, and because of that failure, that loss of hormones, in particular estrogen, we have a horde of symptoms coming at us. The most easily definable one, though, is the irregularity in your cycles, right? So that's how most people would say, okay, I'm menopausal, because their periods start to go all over the place. They get irregular, they become more frequent, they become less frequent, they become heavier, they become lighter. There's a whole spectrum of it. It's very diverse, right? But of course, the term menopause specifically relates, and it's a retrospective diagnosis, yes? So it all has to do with when that last period happens. But you're not going to know that it's your last period, yeah?
Yeah.
So you have to wait 12 months.
Right.
Right? So it's 12 months after your last menstrual period is finished.
So 12 months of zero
12
periods.
months of zero bleeding. So let's say bleeding, because the reality is that because the period changes.
Yeah.
Because it becomes lighter, because it becomes heavier, because it becomes almost non-existent. You could go to the bathroom, wipe, and see a pink discharge. Now you have to start all over again. So we have to define that as your period. So you can go 9 months without seeing anything.
And then see it again.
As a pink wipe on tissue. Yes?
Yep.
To be graphic. And then you have to start again. Then you have to go, oh, crap, okay. Now today is day 0, and we move forward from here.
So let's, now we're going to embark, so we understand now menopause is defined as 1 full year, 12 months of absent periods.
Of absent bleeding.
Absent bleeding.
Absent bleeding, yes,
now,
absent bleeding.
And we only know that after the 12 months has passed. Now, the symptoms of menopause, wide range of symptoms.
Very wide range.
And it affects every single body function, from brain to muscle to bone and all of that.
Absolutely.
I would like for you to explain, now it's because we know that it's lack of estrogen, falling estrogen, and eventually no estrogen that brings about these symptoms.
But it's also because of decreasing testosterone as well.
Great.
Yes?
So explain to us exactly, so before the menopause, a woman in her reproductive age group that will be having normal cycles, she would have normal levels of hormones. And explain to us now how we move from there to the perimenopause and into menopause.
Right. So now you bring up a good point there. So we didn't define perimenopause though, yes? But the perimenopause is from the moment that transition starts. So you could still be seeing your periods, and your periods could still be regular, but you start having symptoms.
Right.
Yes? So ultimately, you're still in that reproductive age group, so to speak, but your ovaries just not working as well as they could have been.
Right.
Ultimately, any person who is premenopausal, so in the definitive reproductive age group, no specific set of symptoms, I'm fine, I'm normal, I'm good, I'm doing what I've done for the last 20 years of my life. So in that time frame, you have hormonal fluctuations, because the whole point of your ovaries, well, not the whole point, but one of the big points is to produce eggs.
Right.
To produce eggs.
To reproduce.
To reproduce. To produce eggs to reproduce, right? To produce a baby, right? And to reproduce. But it also serves other purposes, yes? But we leave that alone for now. In that release of an egg, to make it possible to have that baby, you must have cyclical production of hormones. So you have estrogen and progesterone up and down, right? Well, up first to the point of ovulation, and then down after that, well, tapering off, but not down. That happens nice and easily in every single cycle that you have an egg released. Yeah. You have this lovely, nice, gentle wave that goes about. But then, you know, as you get closer and closer to the magical age of, let's say, 45, average age of menopause, average age of perimenopausal start is 47. Right? So you're creeping towards that age, then your ovaries start to do things differently. You only have a finite number of follicles, you only have a finite number of eggs.
So that's right. So you start off, every single girl, every baby, female baby will be born with 1 million eggs.
Oh, 2 million.
A finite number of eggs.
Yes.
And once they've had their first period, we lose eggs.
Well, even before that. So even from birth to puberty, to the onset of your menstrual cycle, you lose eggs. Right? It just degenerates because it's living tissue.
And there's a significant drop in the number of eggs by the time they hit 30.
There's a significant drop pretty much from birth to puberty. Right? And then from puberty onwards. But, you know, like you said, you might have 5 million eggs. you're born with 5. Who the hell's going to have 5 million babies, right?
Yeah.
The whole point is to have choice.
Yeah.
Right. So by the time you hit puberty, you're probably down to 700,000. Yes, but then again, who's going to have 700,000 babies? So every time when you start to cycle now on a regular basis, you're gonna have choice. So your ovaries are gonna go, okay, let me see how much of these are good eggs. So it might pick 15. And then the 15 dwindles down in the process of that estrogen and progesterone cycling. It will pick an egg. It will pick a follicle that it looks good, you know, that looks like it's, oh, this is going to give me a scholarship. This is the student that's going to shine.
So coming back to menopause, so we're looking at average age patients will, people, women like ourselves, would enter menopause, that is 12 months, no period, would be around 45, 52, 55.
So 52 is menopause-ish, average.
And perimenopause would be
Perimenopause starts, you can have symptoms and you can have irregular cycles for as long as 5 years.
Before you actually go into
menopause. Some ethnicities actually will go into menopause earlier. So Hispanics, for example, go into menopause a little bit earlier. So they may hit menopause at 50 or 49.
So let's talk about the signs and the symptoms. As we said before, it's a whole laundry list of signs and symptoms of menopause.
Yes.
And I'm saying that from experience. And why I'm bringing up the whole perimenopause as the beginnings of hints of menopausal symptoms happening is retrospectively, I myself realized, oh, since I was about 45, I think things were happening in me, but I couldn't put my finger on it. So just describe to us exactly what are the signs and symptoms, the broad spectrum, if you could go through them. Probably about 35 symptoms.
35, 37 symptoms, So, I mean, it's nice to be able to categorize them, So, ultimately, the ones that you hear about, the ones that will be broadcast most commonly are the acute ones. So, the hot flashes, the night sweats, the mood swings, the irritability, the insomnia, right? Even the depression and the low mood, the poor concentration. The poor,
but let's talk about the brain
memory.
The brain. So every single body cell in our body has receptors for estrogen. Estrogen is the coordinator of our whole body. Without estrogen or low levels of estrogen stimulating our brain, we get a whole bunch of things. Brain fog, forgetfulness.
The word aphasia. So the word aphasia is one of my favorites, right? So the word aphasia is the decreased verbal memory.
I forgot the word.
It's like, what's the thingy? The thingy. What's the thingy?
Correct.
That
bring that thing.
Bring that thing. And you're thinking about a pencil, but you can't just remember that word pencil.
Word aphasia.
That's
and many of us are, we know that. Many of us will go into a room and go, I know I came in here for something. I can't remember.
What was it?
Or you're about to say something and you go, I forgot.
So
all of these are just
little
hints that it is coming. Until it actually happens.
You have to put things into perspective too with people though, right? Because I mean, that can happen to almost anybody. But when you find it happening more frequently, and especially when you find it happening with other symptoms, then you have to start thinking, oh, this is not normal then. This is something else going on.
So apart from the brain, then we have the heart, as you were saying, the hot flashes, the palpitations,
the anxiety,
the dizziness,
the moods. The mood swings are kind of psychological, so that's more probably encompassing a little bit more brain than it would be heart. But yes, palpitations are common. Anxiety, because you sometimes don't understand, why the palpitations are happening, and then that could escalate into a full-blown panic attack. So it has its cascading effect as well.
And of course, we all know in terms of our musculoskeletal system, the pains, the joint pains,
that's
the arthralgia, the frozen shoulder, very, very. I think every single woman I see in my office over 45 either have a hip problem, a knee problem, a shoulder problem, frozen shoulder being most common.
Yes.
Adhesive capsulitis.
Absolutely.
Yeah.
Short in stature, so you lose height.
Yeah.
Yes, you lose height.
But
and
we
you
have
lose
high
muscle
heels for
strength. You lose muscle strength as well, right? Because, I mean, and it's from the
Muscle
time you,
atrophy
yes,
is a
you
thing
get, you
with
literally,
lack of estrogen.
Yes. And
Yes.
again, because this happens even before the perimenopause, so you start losing muscle mass in your 30s, in your late 30s, but it escalates, it accelerates, right, when you hit that perimenopausal age range.
So I'm glad that you brought that
Yes.
up because, again, I'm drawing from personal experience. I'm a doctor, but yeah, I mean, experiencing it
Yes.
firsthand, nothing beats that.
Yes.
And I'm an avid exercise
Yes.
buff.
Yes.
Always been exercising.
Yes.
And I found that you're right. I think around 35, I had to really work hard
Harder.
to maintain my
That's
muscle
correct,
mass.
yes.
I mean, I would just shed pounds really
Yeah.
easily.
Yeah.
And then I
Yes.
hit 45.
Yes.
And I could drink water.
Yes,
And I
and
found
feel
suddenly
bloated.
there's
Yes,
a
that's tummy.
pooch below my
Yes.
belly button.
Yes.
What's that about?
Yes, the weight gain is
The weight gain.
is
You can breathe air and you're
multifactorial.
still putting on
yes,
weight.
but it's multifactorial. I mean, at the end of the day, too, there's so many different aspects of, because I mean, loss of testosterone.
Right.
We were talking about earlier.
Yes.
That it's not just about estrogen. There's loss of testosterone can actually aggravate that abdominal bloating and that puffiness that you talk about.
Okay.
Stress plays a large part of that as well.
So that's true.
Yes.
And I mean, I would postulate, again, drawing from my experience, that because of your hot flashes, because
Yes.
of the night sweats,
Yes.
you're unable to sleep
Yes.
and have a good night's
Yes,
rest
absolutely.
for months, for years,
Yes.
until you actually stabilize.
Yes.
And that leads to irritability. That will lead to, of course, increased cortisol levels,
Yes.
increased stress.
Yes. And nothing else in your life has
centripetal
changed.
fat.
Remember that too, right? So your coping mechanisms are compromised.
Yes.
Yes?
Yes.
Because everything else is going on around you the same way that it was before. I mean, why should things change for you, right?
Yeah.
So at
Yeah,
the end
work is going on,
work is going on,
family
family
life.
life is going
Yes.
on, right? So you have to do what you have to do. But you know, you are dealing with additional stresses, right?
And not understanding.
And not
this
yes.
is the thing. I honestly believe a lot of women, maybe even some doctors, maybe at fault of this, not understanding the very huge broad spectrum of menopausal symptoms. It's not restricted to vaginal dryness and loss of libido.
And those are the long-term ones too.
Yeah.
So the ones that happen, and then you see by the time the vaginal dryness, which we now call genitourinary syndrome of menopause. So there's a whole there's a whole name attached to it. Even the muscle aches and pains that predispose to osteoporosis, we've coined musculoskeletal syndrome of menopause. Right? But those things happen later on, right? The osteoporosis happens later on. Even the genitourinary syndrome of menopause, it happens later on. You forget about menopause because you've dealt with it already, right? You've gone through the hot flashes, you've gone through the night sweats. So you know, because those don't always last very long. So you figure that those are finished, they're done. All right, so I'm going on with my life now. No, it's still continuing.
Yeah.
No, we still have these things happening, right? And, you know, you forget and then you realize, oh my God, this is uncomfortable. Why am I so uncomfortable? Why do I have aches and pains everywhere?
So what should a woman do if she has aches and pains? I mean, okay, we've got zero estrogen now.
Yes.
How do we mitigate against that? We want to live long.
Yes.
We want to be able to move around
Yes.
and pick up our grandchildren. Hopefully.
Yes. Okay. Right. Well, I mean, it's not. If you've gotten to the point where you have the aches and pains and they're on a daily basis, they're not transient anymore, then it's probably gone already a little bit too far, right? So what a patient has to understand, what your audience has to understand is the fact that, you need to pay attention to self now in that perimenopausal age range.
We're talking about
right?
40s.
In your 40s.
From the time you hit 40,
in your 40s, you know it's coming. You can't escape it, right?
Start to change the way you take care of yourself.
Yes, exactly. And you have to know what options are available to you. So you have, and you can't be asking your neighbor or your good friend, because what happened with her isn't necessarily, yes, you share things in common, but you can't do what she do and say, well, okay, you know, as Trinis love to do them kind of things.
Yeah.
But it worked for her, so I go try it too now, right? No, those things not gonna happen, right? So you have to individualize your care. So you have to pay attention to self. Right. One of the easiest ways I find to do that, I mean, in my consultations with patients, is I engage them in a menopausal diary.
Yes.
Right.
Talk to me about
yes, I like my menopausal diaries. Right. It's nothing too different from ordinary period
journal.
app and journal. Yeah. Exactly. Right. The only difference is that you have the long list of symptoms on one side, in the column on the left, right, and you literally just tick or score depending on which menopausal diary that you have, that you choose, and there are lots of them out there. You pick one that's suitable to you, and you literally go day by day for a month, 2 months, 3 months, when you remember, right? It helps me. So you see, when that happens and you say, oh my gosh, this is too much, I can't deal with this, right?
Yeah.
This is your own objective assessment of self, right? Then you can now walk into your doctor's office and say, help.
Right.
Yes.
So you kind of collate your symptoms.
Yes.
So that you're able to identify what needs to be sorted out now.
Yes.
How do we address it? Let's just say, and as we said before, it's a wide spectrum of symptoms, signs and symptoms. So a good gynecologist would recommend hormone replacement therapy.
Yeah, well, again,
talk to us about it. Talk to us about the pros and cons.
So one of the limitations that we have here in Trinidad, I know that there are people out there that are hopefully working on it, is the fact that we don't have a lot of HRT available, or hormone replacement therapy. Right?
Why is that?
Why is that? Again, that's not an easy question to answer, but in large part, culture had probably a lot to do with it. HRT, menopause, you know, I mean, we're sitting down talking about it now, but you know that this was taboo before.
Yep. Yeah,
right.
But I think our generation is different.
Yes.
Generation X.
Yes, but we're in control now. We weren't in control 10 years ago, 15 years ago.
I agree.
You know?
So HRT, hormone replacement therapy, is available to a certain extent in this country.
We have one oral preparation available.
Okay.
One. There are...
Effective?
It can't be given to everybody.
Okay.
So you see, hormone replacement therapy is a... You need that calendar, you need that diary, you need to bring that diary in, you need to have it evaluated, you need to be treated based on where your symptoms are, whether they lie in the acute symptom range, whether they lie in the medium symptom range.
So it's not suitable for every woman going into menopause?
It's not going to be, no, because the one preparation that we have is for postmenopausal, or at best, the late perimenopausal patient who is imminently postmenopausal.
Right.
Because it's designed that way, right? It's designed for those patients, to capture those patients, right? There are lots of other formulations available worldwide. We just don't have it available here.
What would it take for it to be available to our women?
Demand, I think. Well, I mean, there's obviously a lot of logistics that have to happen, because it needs to come into the country. It needs to it needs to be approved by the Food and Drug. Yes, I see you nodding your head. Right? It has to be advocated for. Right?
Dr. Ishmael, I'm so sorry that we ran out of time.
Yes.
I believe this topic deserves a second part, because we really have to delve. I would like us to delve more in this topic.
Yes.
With respect to managing, treating, living with it, coping with it.
Because there's so much more to menopause. There's a whole volume.
Correct.
Yes.
So before we go, like I ask all my guests, if there's one piece of advice, one golden nugget of information that you want to leave your viewers out there on menopause, what would that be?
Pay attention to self. Know that it's going to happen. Know that you can't escape it. Pay attention to self. And when you find yourself not being able to cope, then seek attention for it. Go talk to somebody that will know. Yes?
Yes.
Find that person, hopefully a good GP or a good gynecologist who will be able to sit down with you and guide you through it. Because whilst we don't have everything available, there's so much that you can do to help yourself along.
Okay.
And to prevent so many other really potentially problematic chronic conditions in the future.
Pay attention to self.
Pay attention to self.
Thank you very much.
You're most welcome.
I am Dr. Delphina Ovid, your friendly neighborhood dentist. At Community Hospital Dental Clinic, we offer examinations which include x-rays, basic oral cancer screening, and a treatment plan. We also offer cleanings, fillings, extractions, root canal treatment, and complete and partial dentures. Remember, you don't have to brush and floss all your teeth, just the ones you want to keep.
Give us a call at 235-5479.
The Community Hospital of Seventh-day Adventist,
Where good private health care is affordable.
Before you take your omega-3 supplement, check for the natural product number NPN on the label. This unique code shows that Jameson products have approved rigorous Health Canada testing for safety and effectiveness. Unlike some supplements that carry disclaimers like not approved by the FDA, Jameson Omega-3 is the trusted choice, offering 1800 milligrams of EPA and DHA for heart health. Choose quality. Choose Jameson.
Let's talk about quinoa. Chef Emmanuel from Food Hall is going to show us how to use this amazing superfood to create something he calls quinoa with grilled veggie salad. Quinoa is actually a seed. It's packed with protein, fiber, and lots of vitamins and minerals. It's in fact one of the legumes or one of the seeds that contains all the essential amino acids. So we're talking about the absolute superfood of foods.
Problems trying to get aroused, women
Loss
who
of
have
libido.
loss of libido, and women who have problems actually trying to achieve an orgasm. Something as simple as that. So all of those things tend to happen a little bit further along after the hot flashes and the night sweats, but they are real symptoms. They do exist, and they get pushed under the rug quite a lot. So they are commonly underdiagnosed. They're underreported, they're underdiagnosed, they're undertreated.
Struggling with heart health or frequent migraines? Discover the simple steps to reclaim your energy and vitality